Our favorite series, Grey's Anatomy, which has been on the air since 2005 and is now in its 20th season, continues to generate controversy regarding the accuracy of its medical cases. Check out how Grey's Anatomy lied about many of its cases, but told the truth in cases you would never imagine. Please like today's video, which was really challenging to produce, and subscribe to the channel to receive new Grey's Anatomy videos. First, let's start with all the lies. Cardiac massages, please. While getting it right sometimes, it's normal for the series to make errors or overly dramatize certain conditions. After all, the show must go on. One of the main points criticized by healthcare professionals is the excessive use of defibrillators when someone's heart stops. In real life, when the heart stops, what usually happens is cardiac massage to restore heartbeats. According to experts, a defibrillator is used for people with arrhythmia, irregular heartbeats. The electric pulse is used to restore regularity, not to bring patients back to life. According to doctor and YouTuber Dr. Mike, who reacts to medical dramas, the first thing a doctor does during a code blue is chest compressions. Sometimes boredom. Another factor is that a doctor's life isn't always as exciting as it seems on Grey's, where professionals are always chasing surgeries and crazy cases, like 2 people impaled after a train accident, or solving medical mysteries and operating on inoperable tumors. Much of real-life doctors' time, however, involves paperwork. A 2016 study published in the Annals of Internal Medicine found that a doctor spends about 1/4 of their day with patients and nearly double that doing paperwork. Hold on, interns. Among the other lies is the idea that an intern can practice surgery on their first day at the hospital. It's not quite like that. Patients in real life would probably prefer that an intern not participate in their surgeries, and for more experienced doctors, letting a trainee be a lead surgeon can be quite risky.
Hey, pull your balls out of your back pocket. Let's go. Get out of the way. Pansy-ass idiot. Get him out of here. Suction.
How to deliver bad news. According to Dr. Mike, another common mistake in Grey's Anatomy is having direct conversations with patients' families in waiting rooms. In one of the early episodes, intern George O'Malley tells a patient's family that he had died in front of several other people waiting for their loved one's diagnosis. This, he says, shouldn't happen. The doctor needs to take the family to a private area to deliver bad news. This conversation shouldn't happen in an open space. It's a mistake, he says in one of his videos.
Go.
And the nurses? Another problematic point in the series is the underutilization of nurses. In Grey's, doctors draw blood, take blood pressure, give injections, measure blood pressure, administer IV medications, but in reality, things aren't like that. The author of the book, The Real Grey's Anatomy, told an American website that this is one of the biggest medical myths that the show fortifies. Giving injections, ensuring patients get their medications, drawing blood, among other things, that's the care nurses provide, he said. In the series, except for a few nurses, others are sidelined, and the production implies that doctors do everything all the time, and worse, alone. Self-diagnosis isn't welcome. In an interview with Entertainment Weekly, the series' executive producer Zoanne Clack said she has heard reports of people diagnosing themselves after watching episodes. We've had people who, with the help of our episodes, self-diagnosed, or their children, or who appreciate us a lot because they wouldn't have gone after or asked certain things to their doctors, Clack said. It's quite problematic to diagnose yourself based on symptoms shown in the show. A recent study shows that 42% of older adults believe television is their first source of health information, something concerning.
Systolic down to 80.
I could suture directly or clamp. I don't know which one to do.
I don't know either.
Well, my guess is if you came and looked at it, you would have a better idea.
I'm sure that's true, but I'm not the one operating. This is a lot of blood.
She's crashing.
Safety procedures. Another lie is that doctors during surgeries only wear masks for safety. According to Dr. Mike, reality isn't quite like that. Eye protection is necessary too. If blood splashes into your eyes, it's quite dangerous, so at the very least use goggles or a face shield that comes with the mask, he says. It makes sense for the series, but not for real life.
More pressure. Human flesh is a tough shell. Dig in.
the hangover cure. To continue the list, another myth is using intravenous therapies to cure hangovers. In the series, Meredith Grey and April Kepner are champions of the method, commonly used by alcoholics who have lost essential nutrients due to excessive alcohol intake. Mike says this kind of therapy doesn't cure hangovers. Doing this with someone who is healthy and has drunk too much is useless. Just drink water and wait some time, he says.
Are you drinking, Lexi?
Yeah, a drink would be good.
Now that we've seen the lies, let's finally move on to the surprising truths. The case of orgasms. In one of the episodes of the second season of the series, a patient is admitted to the hospital then called Seattle Grace for having a rather unusual condition. She had frequent and spontaneous orgasms and needed surgery to make it stop. Everything was based on a real case. It wasn't an invention of showrunner Shonda Rhimes. Immune to pain. One case that could have been a lie, but isn't, occurred in the third episode of the third season, where a girl is diagnosed with congenital insensitivity to pain with anhidrosis, CPA. During her consultation with the fictional Dr. Alex Karev, the girl claimed to have asked her classmates to hit her with a baseball bat, and felt no pain at all. It's not known if the situation with the baseball bat actually happened, but the girl's condition did.
There. Can I go now?
That didn't even hurt.
Tree Man syndrome. This case is one of the most well-known both inside and outside the fictional universe. In real life, Abul Bajandar from the Bengali region of Khulna has wart-like growths resembling bark and branches on his hands and feet, and has undergone multiple unsuccessful surgeries to remove them. In Grey's, in the 7th season, a young man with the same condition arrives at the hospital for a very complicated treatment, similar to the real-life case it was based on.
They grew back. We saw the guy again, and they grew back again.
You can't just scrape the stuff off?
No, each one of the warts has its own blood supply.
Osteogenesis imperfecta. For those who don't want a spoiler, it's best not to read this part. In the 11th season, the baby of doctors April Kepner and Jackson Avery is diagnosed with osteogenesis imperfecta, the most severe type of brittle bone disease, and the doctor faces two options: abort the baby or schedule a delivery date, knowing the child would survive only a few minutes, if at all. The condition is quite rare, with around 15,000 cases confirmed annually in Brazil. Cobalt contamination. In the 16th season, no spoilers, one of the characters begins experiencing various strange symptoms like forgetfulness, hallucinations, and slurred speech. Initially, Alzheimer's was suspected, but it didn't take long for one of the doctors at Gray Sloan Memorial to discover that the patient's symptoms were actually due to cobalt contamination caused by a total hip arthroplasty. When leaked, cobalt can cause symptoms resembling Parkinson's disease, as well as hallucinations and dementia.
Hey, Richard. Do you know where you are?
Gray Sloan Memorial? If this is a quiz, you might want to ask some tougher questions.
The patient without a heart. In one episode of the series, one of the hospital's doctors opts to make a completely unusual decision: keep a patient alive solely with the aid of machines, without her heart, until a transplant becomes possible. The case, which seemed crazy to many, actually happened in real life. In the series, patient Kelsey Simmons spent about 6 weeks connected to devices that mimic the function of her heart. In real life, a person lived 4 months without their heart. For example, while waiting for a transplant in 2016, patient Stan Larkin lived 555 days without the organ. falling 47 floors and surviving. In the early seasons of Grey's, a desperate man jumps from the 30th floor. Even so, he survived to tell his story. In real life, the case was even more surprising. In New York, Alcides Moreno fell from a platform at the height of 47 floors. His brother died from the fall, but Moreno survived after a series of operations in the emergency as he was too fragile to be transferred to the surgical ward. After being in a coma for a few months, he regained consciousness around Christmas and, a month later, was discharged from the hospital, recovering the movement in his leg about a year after the accident. Kawasaki disease. Another time Grey's got it right was by bringing up a case of a 10-year-old boy with Kawasaki disease, a condition that causes inflammation in the walls of some blood vessels in the body, whose initial symptoms are fever and body aches, making the diagnosis quite complicated. The episode was entirely based on the experience of the actress who plays the child's mother in fiction, Sarah Chalky, who for years struggled to identify the disease her son had. In more severe cases, the disease can lead to death, but her son survived thanks to research on the internet about the symptoms he had, which were fully compatible with the disease.
Right. Is he still sick? Well, his fever was down when I left for my shift. I'm a waitress. Then my neighbor called. She said it spiked again. And then when I got home, he had this rash.
You've been giving him the meds, lots of fluids.
Yeah, but his fever's...
The Kandiru case. Another case that may seem like a lie but isn't, occurred in the 3rd season of the series, when a man is admitted to the hospital with complications in his penis. Soon, doctors discovered that what happened was that the Amazonian fish Kandiru had entered the man's urethra. This happens when individuals relieve themselves in the rivers of the Amazon. Tilapia skin to heal burns. Art imitates life, and in this case, it imitated a Brazilian research done by the Research and Development Center for Medicines, NPDM, at the Federal University of Ceará, UFC. In the series, the discovery was attributed to Dr. Jackson Avery, who decided to use tilapia skin to treat burn victims. The fish's skin is used for its faster healing effect and does not require as many changes, since the collagen present in it interacts directly with the wound, facilitating healing. The entire coverage of the skin also prevents contamination of the burned area. The pregnant man. In the series, a cisgender man believes he is pregnant because his belly grew and all the pregnancy tests he took were positive, but he wasn't pregnant. What happened was that the series producers used a rare tumor, teratoma, to create the story. Teratoma is basically a tumor with small pieces of teeth, tissue, and nails, and produces the hormone HCG, which explains the positive pregnancy tests. Cancer forever. Another real case, and based on the life of one of the people involved in the event of the series, was that of the character Catherine Fox. The businesswoman found out in the 15th season that she had a cancerous tumor located in her chest. Despite surgery, the doctors responsible for her treatment were unable to remove it completely, and she learned to live with the cancer inside her for the rest of her life, although it was benign. The story was based on that of screenwriter Elizabeth Finch, who once said she hated hearing the words battle, fight, and defeat when it came to her cancer. Meredith Grey's monologue at the beginning of the episode, as usual, was a tribute to Finch. Battle, fight, victory, defeat. These are words we use when someone is sick. We use military language that implies a fair fight, but when it comes to life or death, what really comes to be a victory?
This award is named for my dear friend who we lost this year, which makes this award ever more meaningful. Harper Avery was a very complicated man.
The challenges of COVID-19. The entire 17th season of the series revolves around various problems that doctors and citizens face during the COVID-19 pandemic. In one of the episodes, a group of teenagers throws a party that ends in an accident, and in another situation, a white man refuses to be attended by a Chinese doctor. Aside from these situations, the series shows the drama of healthcare professionals isolating themselves from their families, often spending nights in hotels or even inside the hospital to care for patients. This leads to two important characters, no spoilers, contracting the disease with severe symptoms requiring ventilators. Without an approved treatment, doctors rely on scientific studies with few samples and standard cocktails. And of course, the series also addresses another issue faced during the pandemic, the incorrect use of protective masks. These were all the clinical truths and lies of Grey's Anatomy. Hope you enjoyed today's video. Leave your like and share it with that friend of yours who loves Grey's Anatomy as much as we do. Subscribe to the channel if you're not already subscribed, and until the next video.